Over the past 24 hours, we have identified 860 new cases of COVID-19 and completed just over 12,000 tests. This means our provincial positivity rate sits at about 7%, and our active case number has risen to 10,031. There are 264 people in hospital. Of those, 57 are in ICU. These numbers continue to be concerning. While we have spoken of Edmonton's hospital capacity and surgery cancellations, I want to stress that this is a concern across the province. Since my last update, a new outbreak has been declared on a unit at the Queen Elizabeth II Hospital in Grand Prairie, where 2 healthcare workers and 1 patient have tested positive for COVID-19. In addition, the outbreaks at Chinook Regional Hospital and Bow Island Health Centre in South Zone were declared over on November 14th, and the outbreak on the cardiac unit at Foothills Medical Centre has also ended, with operations on this unit returning to normal. I have heard questions about how our COVID hospitalizations and ICU numbers compare to the increases we see in influenza seasons, and why our current acute care burden is so challenging. It is important to remember several differences between COVID-19 and influenza. An illustrative example is that we have had 49 acute care COVID outbreaks in just 7.5 months, with 42 deaths linked to these outbreaks. This is despite extraordinary measures to prevent spread in the community and in the hospital. This is far worse than the worst acute care outbreak numbers related to influenza in the past 5 years. 40 outbreaks with 13 deaths in a full year. COVID is more dangerous than influenza, both at an individual and population level. Other differences between influenza seasons and what we are dealing with now include the extraordinary measures that are needed in order to prevent spread in hospital. These processes enhance safety, but also limit capacity, including much more aggressive isolation policies, where patients who have any symptoms that could be COVID, patients with confirmed COVID, and patients who have had a COVID exposure need to be in an isolation space. This means not regularly using multi-bed rooms, more widespread use of personal protective equipment, which takes time to properly put on and take off, and other changes that limit the number of available beds for use. Another big impact on capacity is staff availability. With the strict isolation and quarantine requirements for COVID that are necessary to protect acute care and prevent spread in all settings, staff who have been exposed to COVID, staff who have symptoms that could be COVID, and staff who have COVID are not available to work. As community transmission increases, more healthcare workers are exposed in various settings, or perhaps have family members exposed. This impacts the system, as services cannot be operated without skilled workers to provide them. Finally, the volume of continuing care outbreaks impacts acute care, as patient transfer from acute care to continuing care is limited when outbreaks are underway. This is not an influenza season. This is a global pandemic that requires each one of us to pull together to protect our communities, families, and friends. Sadly, I must also report 20 new deaths over the past 24 hours. These are not just numbers. These are people. As our cases rise, our deaths will rise. Every time I speak about deaths, I offer condolences because each one of these people will be missed and mourned. The measures in place right now are literally a matter of life and death, and the choices Albertans are making now will determine our future in a few weeks. Turning to schools, there are currently active alerts or outbreaks in 309 schools, about 13% of all schools in Alberta. Currently, these schools have 1,046 active cases in total. This number includes 65 schools that are currently on the watch list. So far, in-school transmission has likely occurred in 151 schools. Of these, about 79 had only one new case as a result. I commend schools for the work they do each day to keep cases as low as possible, and I know parents, students, teachers, and staff continue to be concerned. As children can mimic adults, and parents know this happens at inopportune moments, our schools mimic what is happening in the community. This means that when we drive community transmission down, we will see this reflected in school numbers. So if you know a teacher or a student going to school each day, think of them as motivation while you recommit yourself to public health measures. These rising numbers that we are seeing are straining our system in many ways. One of these is the challenge in contact tracing, as each case on average now has about 15 close contacts within their infectious period. That means with about 1,000 new cases a day, there are about 15,000 people every day who are new close contacts. It is impossible to make phone calls to each one, which is why AHS has changed their processes and is using technology like the online portal to speed up this work. Since AHS launched this portal on November 12th, about 25% of notified positive cases have used it to enter close contacts. Thank you if you are one of those people. This is a good start, but we need to do more. I understand that getting a positive test result can be overwhelming, but please follow all direction from AHS for sharing your contact information. They have made it easy and it is anonymous. Your information is not shared with the close contacts you enter in the portal. As I have mentioned before, there is a lag time between our actions and their results. If we all follow public health measures, along with any additional restrictions in our communities, we could start to see results in the next 1 to 2 weeks. So for the next 2 weeks, I encourage Albertans to redouble their efforts. Stay home if you are sick. Wash your hands regularly and don't touch your face with unwashed hands. Maintain distance from those outside your household and wear a mask when you're in indoor public spaces. Now is not the time for parties. If you are in a community under enhanced status, it is imperative that you do not have unnecessary visits from those who do not live with you. For those not in enhanced areas, remember, smaller is better when it comes to gatherings. We all need to do our part. We have great power when we work together. We are seeing this in our influenza numbers this year. We have called on all Albertans to do their part to support our health system by getting their flu shot. And you have answered that call. More than 1.1 million Albertans have already been immunized, compared to about 940,000 at this time last year. This is incredible, and what is more encouraging is the successes that we are seeing. As of today, we have not had a single laboratory-confirmed case of seasonal influenza, and therefore no hospitalizations or deaths related to influenza this season. Overall, in the 2019-20 season last year, we had 8,470 lab-confirmed cases and 41 influenza-related deaths of individuals who were hospitalized. I hope that you see this as some light in the darkness. These results of record vaccine uptake and no cases demonstrably show the power of working together. The question of capacity, the healthcare system is currently able to manage the COVID cases that are presenting. And in some places like Edmonton, the way that they've done that is to stop offering other services. So we do have a limited amount of capacity in the health system in terms of the number of skilled staff, the number of beds, and currently the system is able to accommodate, again, these extra COVID cases by stopping some of those other services. And with the numbers that we've seen over the past couple of weeks, we know that there will continue to be a rise in demand for hospitalizations in ICU over the coming 1 to 2 weeks because of what we've seen historically in cases. However, the question of what happens after that time period, again, rests in all of our hands. And of course, we did put in additional measures last week. And the question of whether or not those measures will be sufficient to bend that curve down so that we do not, again, impact the healthcare system. And I want to underline that point that if we see increasing COVID cases going into hospital, the only way to provide the space to care for them is to stop doing other services. So there is always some degree of trade-offs, and Albertans who need other care could end up having their health conditions worsen as those COVID case rises. So these are all the reasons why coming together over this next time period, pulling together to do our part to stop community spread, to bring those numbers down so that we don't see an ongoing rise in cases. Again, that's in our hands, and if the current measures are not sufficient, then additional ones will have to be considered.